Hi, welcome back to the autonomic nervous system. I just want to make sure that you took a pause between the last video and this one to make sure you really understood everything we covered so far, because in this part we're really going to dive into the nitty-gritty details, and if you don't understand the first part, you're just going to be absolutely lost on this next part. So if you need to, stop and go back and review the previous and really understand it. So now we're going to learn more details and some terminology. And the first terminology are the terms cholinergic fibers versus adrenergic fibers, and then their receptors. So the term cholinergic refers to the word acetylcholine. So cholinergic fiber is one that has acetylcholine as its neurotransmitter, and so it's going to bind to a cholinergic receptor. So this is an example of what we would have in the somatic nervous system. As opposed to that, an adrenergic fiber is using noradrenaline / norepinephrine as its neurotransmitter, and so we say the receptor is adrenergic. So this is kind of weird because we use the term adrenergic for the receptor and the fiber, but usually we use the term norepinephrine when we're talking about the neurotransmitter as opposed to noradrenaline. Don't know why that is. It's just one of those weird facts. So here I have listed 6 different types of neurons, okay? And what I would like you to do at this point is, since you have reviewed and you really understand the previous material, stop it at this slide and figure out which of these 6 are cholinergic and which of these 6 are adrenergic. So go ahead and do that, and I will meet up with you once you have figured this out. Okay, so that's awesome. And if you needed to, because you weren't 100% confident, if you needed to check on that previous slide, that was fine as well. All right, so let's talk about these fibers. So cholinergic fibers are all of our somatic fibers, all of our preganglionic fibers, meaning parasympathetic preganglionic and sympathetic preganglionic, in addition to our parasympathetic postganglionic fibers. That's what we know up to now, correct? All right, let's add just a little bit to it. We have the exceptions, okay? There are postganglionic sympathetic fibers that go to sweat glands and some blood vessels that do not use norepinephrine as their neurotransmitter. They use acetylcholine, okay? So in this picture where the red arrow is pointing, this is the exception to what you have previously learned. So tiny little category, but clinically it can be very significant. So if your ultimate career goal is nursing or pharmacology or being a PA or a doctor or a dentist, this is going to be an important detail as far as how certain medications will work later on. Looking at the cholinergic receptors, we actually have 2 huge different subtypes, okay? And there's a nice little graphic here showing you the differences that's going to happen, but let me talk about the 2 different subtypes. The first I'm going to talk about is called a muscarinic receptor because it's related to this lovely little magic mushroom over here. And muscarinic receptors are found on cardiac muscle and smooth muscle, exocrine glands, so think of your salivary glands, and can be either excitatory or inhibitory. And they're going to work via second messenger systems. So we've learned about some already, and hopefully later on you'll learn about some more. And the thing about muscarinic receptors is that we can block all of their effects with atropine, okay? So normally a muscarinic receptor would be inhibitory to cardiac muscle. Your heart rate would go down, but your smooth muscle would and your bronchi would constrict, so that would lead to wheezing. and your blood pressure would plummet. And so we can reverse those effects with atropine. Your heart rate goes up, the breathing becomes a lot easier. We can break an acute asthma attack if we had to. All right. In contrast to the muscarinic receptors related to the amanita mushroom, the other type are called nicotinic receptors because they're related to the flowering plant Nicotiana, which is the tobacco plant, okay? And so this is what's found in all of our autonomic ganglia and in our adrenal medulla cells, as well as the neuromuscular junction. And it's always going to be excitatory. So it's always going to cause muscle contraction, okay? As opposed to the muscarinic receptors, where it can be excitatory or inhibitory. So that's it for cholinergic receptors, where acetylcholine is acting on either muscarinic or nicotinic receptors. Adrenergic receptors are involving norepinephrine, and they usually will involve a G protein or a second messenger system. So let me talk first about the far right, where we have the beta adrenergic receptors. So these are just going with alpha and beta, as opposed to fancy names as we had in the cholinergic things. Beta receptors all promote cyclic AMP as their second messenger. So we have that normal G protein acting on adenylyl cyclase, which causes ATP with a kinase to become cyclic AMP. And we have two different types of beta receptors. A beta 1 receptor works on the heart, where it's excitatory, so it's going to increase the heart rate, and it's also going to increase the force of contraction, thereby increasing how much blood is being ejected with every contraction, and then it's being ejected faster. And so that really can increase circulatory output to all the organs. In contrast to that, beta 2 receptors act on smooth muscle, and it's inhibitory, so this would lead to bronchodilation. So those are the beta receptors. They're pretty straightforward and easy to understand. Alpha receptors are usually excitatory, thereby causing smooth muscle contraction. There's two big categories. Alpha 1 are found on smooth muscle. They're using calcium, so they use a system. I'm not sure if we talked about it already. If not, it gets definitely involved in later organ systems like the endocrine system and the renal system, where we are going to deal with phospholipase C as the enzyme instead of adenylyl cyclase. So the G protein acts on phospholipase 3C, and then we have a couple different pathways from that. The net result of all of these is calcium. And so it's going to be using calcium as the second messenger, causing smooth muscle contraction. So that's an alpha 1. Alpha 2 does basically, it's blocking a couple of different things. It can block a neurotransmitter release, and it also can, so in other words, block the release of norepinephrine, since it's adrenergic, and also can inhibit cyclic AMP production. So this would be the opposite effect of a beta receptor. So here is a slide where we're talking about all these neurotransmitters, all the receptors. I have to put my glasses on because I cannot possibly begin to read any of these letters. So if you talk about sympathetic, we have acetylcholine in the ganglionic one, and then we have norepinephrine. So we have adrenergic receptors, whether they're alpha 1, alpha 2, beta 1, beta 2. Yes, there are some other ones I didn't talk about, so you don't have to know about beta 3. The exception being the sweat glands, which will use acetylcholine at the target organ, and this is going to be a muscarinic receptor. Then we have the sympathetic division that went to the adrenal medulla, where this is going to be a nicotinic receptor, which causes the release of mostly epinephrine, 80% epinephrine, 20% norepinephrine into the bloodstream. And then in contrast to this, the parasympathetic division now looks positively quaint and very simple, where you're going to have a nicotinic receptor at the ganglion and a muscarinic receptor at the effector organ. All right, so let's step back and review this in its entirety now. Comparing parasympathetic to sympathetic. Parasympathetic was long then short, acetylcholine everywhere. Sympathetic was short then long, nicotinic receptors for acetylcholine, and then norepinephrine, which had other types of receptors. Sympathetic nervous system was thoracolumbar, which then went to sympathetic ganglia the entire length of the spine. Parasympathetic was either cranial nerves 3, 7, 9, and 10, and there are ganglia up here in the head, which we didn't learn about. And then we have sacral outflow, where we're going to have parasympathetic ganglia, for instance, in the wall of the urinary bladder, the uterus, and other reproductive organs. So homeostasis is this delicate balance between these two. We are constantly having some degree of autonomic nervous system stimulation going back and forth between parasympathetic and sympathetic. And it's this background activity that gives us this resting tone. So just like we talked in skeletal muscle, how there was resting muscle tone, we have this resting autonomic tone in all of our effector organs, whether they're smooth muscle, cardiac muscle, or the glands. And the other concept, which I hope you got, and I did not mention the term previously, is that there is dual innervation. And neither division, sympathetic or parasympathetic, is 100% excitatory or 100% inhibitory. Although students like to think sympathetic is excitatory and parasympathetic is inhibitory, and that was a great starting point. But then we had to learn more details past that. Generally, however, they are antagonistic to each other, in that generally sympathetic effects will be the opposite of parasympathetic effects. However, there are places where they are cooperative. For instance, when we look at saliva coming from our 3 salivary glands, 2 of the glands give us water in our saliva, and that's a parasympathetic effect, and 2 of the glands give us mucus, and that's a sympathetic nervous system. And you're saying, well, I thought you just said there's 3 glands, but you gave us 2 and 2, which is 4, because one gland has both parasympathetic and sympathetic innervation. Okay. So if it's going to take you a little while to get this, don't worry about it. I know you're thinking that most people just went through it once and they got it immediately and they're going to win the big prize. But what most people who are successful know, there are little failures along the way. And I can't tell you how many times I had to go over this before I got it. And there's even times where I have to stop and think, okay, so what was alpha 1 versus alpha 2 again? And where's the what? Okay, and then what's the what? Okay, yes. And so even people who have been doing this for a long time at times have to stop and pause to make sure they don't misspeak. So I don't expect you to get it all immediately, but I do hope you will continue working on it until you get it. And with that, I am going to stop, and you have completed all the videos on the autonomic nervous system. So kudos and congrats, and continue all the hard work. You're doing a great job.